stroke prevention reduce risk of dementia in old age? Usually there is an epidemic of dementia as the population ages. Clinicians and researchers are still trying to get a handle on how to reduce a person's chances of dementia late in life. Ontario's stroke prevention strategy appears to have had an unexpected, beneficial side effect, a reduction also in the incidence of dementia among older seniors. That is a pretty powerful one-two punch. A paper by researchers at Western University, Lawson Health Research Institute and the Institute for Clinical Evaluative Sciences shows there has been a decade-long drop in new diagnoses of both stroke and dementia among those who are 80 or older. Published in the Journal of the Alzheimer's Association, the journal Alzheimer's and Dementia on March 28, 2017. Joshua Ceresulo, a candidate in epidemiology and biostatistics at Western Schulich School of Medicine and Dentistry, is the study author, and Dr. Vladimir Hakinski, a clinical neuroscientist at Western Schulich School of Medicine and Dentistry, a Lawson Health Research Institute scientist and neurologist at London Health Sciences Centre. He is a world pioneer in stroke research and a co-supervisor of the research paper. What this data suggests is that by successfully fighting off the risks of stroke, we can also curtail the incidence of some dementias. This is the first study that has looked at the demographics of both stroke and dementia across Ontario since the province pioneered Canada's first stroke prevention strategy in 2000. With lifestyle changes, we can reduce our risks of both stroke and some dementias. That strategy includes a healthy diet, exercise, a tobacco-free life and high blood pressure medication, by which we can prevent stroke to an extent. Most strokes are caused by the restriction or constriction of blood flow to the brain. Vascular dementia also develops as blood supply to the brain is reduced. Someone who has had a stroke is twice as likely to develop dementia. Someone who has had a diagnosis of stroke has also likely had several prior silent strokes that may have affected a patient's cognitive abilities. The incidence of new stroke diagnosis among highest risk group, people aged 80+, dropped by 37.9% in a span of a little more than a decade. During the same time frame, the incidence of dementia diagnoses in that age group fell by 15.4%. Some we cannot influence, yet, but here is a pretty clear indication that we can take specific definitive steps to reduce our chances of dementia related to vascular disease. This work suggests there are policy implications where stroke and dementia work can intersect. But more research needs to understand the specific relationships between stroke and dementia. Any studies looking at stroke prevention should also investigate dementia prevention also. The take-home message is that we can prevent some dementias by preventing stroke. Thank you.